Uganda's confirmed cases of COVID-19 currently stand at 18. This comes at a time when a partial lockdown of the country has been instituted by government through banning the use of public transport, encouraging people to stay at home, as well as closing all places of public gatherings. According to Dr. Ben Masira, an epidemiologist with African Field Epidemiology Network, the outbreak of a pandemic like COVID-19 can be handled in two ways.
These include drugs and vaccines. Then the second means is what we call the non-pharmaceutical methods or interventions. And these methods include things like protective measures such as gloves.
However, because this disease can be passed on through contact and the close proximity to infected persons, emphasis has been put on separating people through lockdowns.
People come close to each other, especially if there is a patient who is suffering from this infectious disease, COVID-19. When they cough, now if you are within a distance of 1 meter from that person, you will inhale those droplets. And those droplets which are infected with the COVID-19 will actually infect you.
If not separated and left to move in large crowds, it becomes easier for the coronavirus to be transmitted from one person to another.
Let's say you have gone to a church for prayers, and within that church there is only one case of COVID-19. And that person will be surrounded, let's say, by 10 people in his or her environment. So by the time probably the prayers end, 5 out of those 10 people, 2 to 5 out of those 10 people would be infected with COVID-19.
Health officials warn that the best way for the country to be able to combat the COVID-19 disease is by Ugandans staying at home through a partial or complete lockdown.
You are locking down to prevent transmission of that infection from one individual to the other. Because for bigger masses, that's where the problems are.
Dr. Masira highlights some of the countries that have found success with this method.
One of them is China itself, where the disease started. China had a very massive and effective lockdown of the cities and all the areas which had cases.
Globally, COVID-19 infections stand at 550,530 with 24,903 deaths, while the recoveries stand at 128,701. Joyce Nakato, NTV Weekend Edition.